Thank you. It's a pleasure to be here with you this afternoon. And I want to say that for my presentation, I went old school. So on the back table are handouts, no PowerPoint. And you're welcome to take them. I don't think it's necessary to learn from the presentation to have the handouts. So first of all, I want to ask if there are folks here in the room who've heard of Everyone Home. A couple of folks have heard of Everyone Home. Okay, well, it's the Alameda County's plan to end homelessness by the year 2020. And the League of Women Voters was one of the plan's first endorsers. The plan was originally published in 2006. And it is a plan that's part of an Everyone Home. The organization I now direct is in charge of implementing the plan, which is coordinating the work of all of the cities in Alameda County, Alameda County's Housing Department, Social Services Department, Healthcare Department, and all the nonprofits and service providers and developers that work on helping to house the homeless and maintain their housing stability. So we're trying to coordinate that work so that everyone's moving in the same direction, the direction of being ending homelessness rather than continuing to manage it. And that has been part of a national trend across the country. And I'll tell you, in the early 80s, when we first started seeing homelessness on the American landscape, our response to it was to open emergency shelters. And we thought of those in our field, we call them 3 hots and a cot. And so we basically thought if people had a place to stay for a little while and some food, they'd get back on their feet and back into housing. And we may have noticed that really did not happen. And so what we thought we needed to begin doing, what we saw was that people who needed to stay in these emergency shelters, often opened in armories and church basements, etc., had a lot of troubling things going on in their lives. And we began to develop theories that the troubles in their lives were contributing to the fact that they became homeless in the first place and maybe why they were staying homeless. So we started a lot of services to get people ready for housing. And so shelters began to have support groups and case management and therapy and drug counseling and job counseling and parenting classes and preschool centers. And we went into this thing of creating service-rich emergency shelters and something called transitional housing. Have people ever heard of that? Okay, so that was a big trend in the 80s and 90s, and you may serve on nonprofit boards that have developed some transitional housing. And this was supposed to give people time and tools to really, really, really be ready for housing. And guess what happened at the end of transitional housing for many people? There's no housing. So early in the 2000s, we came up with this concept that homes ended homelessness. Now, it took us a couple decades, but I think it was pretty brilliant. So I'm standing by that. What ends homelessness is homes. There are more alcoholics housed than on the street. There are more mentally ill people living in housing than on the street. There are more obnoxious, difficult people you don't want to talk to living in housing than standing on a street corner, right? So all the things that we might think keep people homeless are not what keep people homeless. It's a fact that they don't have a home. So the way that we might solve that then is to focus on providing housing first. So what has happened in the last decade in our field is that we've said what homeless people need is housing. Now they may need a bunch of other things like health care and food and income and all that stuff, but they don't need that before they're housed. And in fact, people get healthier and stabler in housing that is permanent, that they can afford. So the focus now, so the federal government in the early 2000s said that they wanted communities to write plans to end chronic homelessness for the folks who have been on the street for a year or more, and have a disability, Alameda County chose to write a plan to end homelessness for anybody that would become homeless. And we worked on that plan not just with homeless agencies, but also with mental health care providers and the mental health care department, the Office of AIDS, the Social Services Department, because we felt like all those units of government and all those community agencies were touching very much the same people, and that we wanted to both look at the people who were very much at risk of becoming homeless, as well as those who are already homeless, and solve the housing crisis for the most vulnerable, lowest income, disabled populations in Alameda County. And we said we'd do this by 2020. So we're ambitious, but we actually are achieving some things. And I want to share that with you because in this environment that looks so grim for housing, we're seeing some substantial impacts around homelessness in this county. We have 5 strategies in the plan: prevent homelessness and other housing crises, create 15,000 housing opportunities by 2020, deliver flexible services, and you noticed earlier in the earlier presentation, the redevelopment money helped start about 15,000 units of housing across all of California. So you could accuse the folks involved in Everyone Home of a lot of things, but not lack of ambition. Because we said we needed 15,000 right here in Alameda County. And we committed to delivering services to the folks in housing to maintain their housing stability and improve the quality of their lives. The folks that have been on the street a long time, as I know concerned citizens such as yourselves are aware, have struggled with a lot of health issues that are exacerbated by their life on the street often. And then we committed to measuring success and reporting outcomes and developing leadership and long-term leadership and political will, which is part of why talking to folks like you is so important, because we really want to spread the belief that ending homelessness is possible and a commitment to doing it. And so, because we're committed to measuring progress and reporting outcomes, I have hard data about what we're doing to end homelessness and how far we've gotten. And I want to start with telling you what we've done about prevention, because prevention and rapid rehousing, because it's teaching us something about what we need to do around the housing opportunities we're creating. So the federal stimulus money included the federal stimulus, much maligned, falsely maligned federal stimulus package, included in it $1.5 billion across the nation to prevent homelessness and rapidly rehouse. So we said, with the housing crisis that's going on across the nation, there are people at risk, unemployment, at risk of losing their housing. Let's put some money in communities so that that doesn't happen. So Alameda County worked with just under $10 million over the last several years. And we've got funds to last through July of this year. But so far, we've helped close to 4,000 people keep their permanent housing who were at risk of losing it. And over 850 people who were already homeless get rehoused permanently. And we were able to help them not just with back rent, but shallow subsidies on their rent going forward for a short period of time. Or not just first month's and deposit, but shallow subsidies going forward. But most people needed that help, turns out, for 3 months or less. And less than 1% of them have come back into the homeless system of care, even a year after we stopped assisting their rent. Now you would hope while we were assisting them with their rent, they wouldn't become homeless. But a year later, after the last check was cut, we're still not seeing people return to the homeless system. So people we thought who were high barrier folks, hardest to house, needed, in fact, around $1,500 to $2,000 from the system to get back into stable housing or to keep stable housing. Turned a lot of our work that we've done in this field a little bit on its ear. That the people actually needed a very small amount of money to restabilize their lives. And interestingly enough, a good number of them didn't want us managing their lives after we helped them. much thought they were grown-ups and they'd go on and do that for themselves. And so we are really thinking, when I started in this role, and I've been in the field of working on homelessness for over 20 years now, I ran shelters for 15 years before I took this job. When we first started in this work of ending homelessness, we thought we needed to build supportive housing, which is the most expensive affordable housing because it comes with a lot of services. But it turns out not every person who becomes homeless needs supportive housing. Most folks who become homeless have had an economic crisis and they need a little boost to bounce back into housing. Now they're still going to have a tenuous grip on housing stability and they might need that bounce another time, but that's still a lot cheaper. $2,000 is different than $15,000 or $25,000 a year, which is what it costs often to keep someone in supportive housing. Now there are folks with very serious mental illnesses, major chronic health conditions, struggling with substance abuse and long-term substance abuse that do need those wraparound services, but not everybody who's homeless does. And so we're working on creating a mix of that supportive housing and kind of this boost back into the housing that already exists in the community. So that made us rethink our goal a little bit about the 15,000 units we said we needed to create. Because as you heard, it's really complicated and takes a long time to build units of housing. So we're really not going to build our way out of homelessness. We also need to take advantage of the affordable housing that's getting created and the housing that already exists and make sure it's accessible to extremely low-income folks. So Everyone Home has done a lot of advocacy so that the public dollars that are spent on housing go to create units for extremely low-income people. I was very pleased to hear the question to the earlier panel, what's the percentage of the units that have gotten built that have gone to low and extremely low? Extremely low income is 30% of area median. Folks who are homeless are typically getting about 15% or lower of area median. So they're even poorer than the 30%. But we have, using that framework of focusing on not just supportive housing units being built, but affordable units that are affordable to extremely low income folks. We've got over 1,600 Everyone Home units built in Alameda County. Everyone Home is not building the units. AHA and Eden and EAH are building the units, but we're just recognizing that they could be units that would house this population. And we're creating lease-up strategies to make those, we've created them and we've got developers using them to make those units accessible. Sometimes we build housing to house homeless people, and then we don't want to put people in there who've had evictions or bad credit history or a legal history, but guess what? That's a lot of homeless people. So we've been working, we've really been advocating, and so when you see affordable housing developments being considered in your communities, you can ask the questions as concerned citizens. Are any of the units funded going to extremely low income? Are you using the Everyone Home lease-up strategies to support people with histories of homelessness getting into those units? So we've got another 1,300 in the pipeline. So a substantial number of units are still getting created in this environment. And I will tell you, the homeless count we did in January of 2011 showed a 3.8% reduction in overall homelessness in Alameda County and a 13.6% reduction overall in the last 4 years. Family homelessness has gone down 28% in the last 2 years and by over 50% in the last 4 years. So we are making impacts. We know what to do. And the populations we focused on, serious mental ill has gone down 20%, veterans 15%, because there's resources targeted that population. Population that's going up, single males, unfortunately. And so we need to find a way to solve that, and we are concerned. Homelessness is a lagging indicator. People don't typically lose a job or get foreclosed on and then end up on the street. They spend several years moving through friends and family, savings and resources. And in fact, most people that are foreclosed on don't ever end up homeless. They figure something else out. But we are concerned homelessness may go back up. But we do know how to solve this problem. And if we allocate resources and adopt policies on the local level, we can, in fact, end homelessness. A housing crisis does not have to turn into a permanent status of being homeless. And so I'm happy to take questions at the end and appreciate your including the issue of homelessness in your focus on housing today, because homes ends homelessness.